Good morning. It is my pleasure to welcome you to our town hall meeting for the Kallah teachers, Doulas, and Mikvah attendants. This is brought to you by the Jewish Orthodox Women's Medical Association, otherwise known as JOMA. My name is Dr. Denise Moses. I'm an OBGYN, and I will be moderating this event. This past year has been a challenging year for everyone. The loss of life from COVID-19, the pandemic restrictions on normal living, and the challenges of rapidly evolving medical guidelines and erosion of trust in previously reliable institutions have affected us all. Just a few months ago, in what can only be described as a gift from Hashem, the COVID vaccine was developed and granted emergency use authorization by the FDA. The breakthrough of the vaccine is the first real step in terms of safe return to normalcy to the life we were used to living. At the same time, people are understandably hesitant about taking a new vaccine during a pandemic, which has already shaken people's confidence in science. Compounding matters is the sheer volume of rumors and sensationalism around the vaccine that bombards us from morning until night from all directions. Everyone attending this morning is in a position of mentorship toward other women. The goal of this morning's event is to answer your questions about the vaccine and provide resources that you can feel comfortable directing other women to get answers on about the vaccine. We're lucky to have with us this morning two women physicians who have agreed to donate their time to this important cause. Dr. Dani Halpern is board certified in internal medicine and pediatrics. She works as a hospitalist for Brigham and Women's Hospital and a hospital's pediatric emergency room physician for Boston Children's Hospital. She is also actively involved in teaching medical students and international physicians through Harvard Medical School and Alpert Medical School of Brown University. Dr. Alyssa Hellman is an OBGYN and has been in practice for the past 10 years in Milwaukee, Wisconsin. She is also the physician at the Confident Kallah, a telemedicine gynecology practice focusing on the needs of Jewish women who observe Taharat HaMishpacha. She received her medical degree from NYU, and she did her residency at North Shore University Hospital in Manhasset. Each of our panelists will give a brief introduction, including updates to Mikvah guidelines, and we will then proceed to the Q&A portion. We have had many questions submitted, and unfortunately, we will not be able to get to every single one. If we do not get to your question, please follow us on Instagram at joma.org for more questions, more answers series, where we will continue to answer your questions about the vaccine, or log on to joma.org/COVID-19 for further resources. We will not be able to answer any personal medical questions. For those type of questions, please consult your physician. At the end of this event, please follow the link on the website to fill out our survey for a chance to win a $100 Amazon gift certificate. Please stay tuned for future events. This information can be found below and at joma.org/COVID-19. We'll be having another event this Tuesday evening for healthcare professionals, and details will be on the website. We would like to extend a heartfelt gratitude to our partners and volunteers who have worked tirelessly to make this happen. We did not receive any funding or support from any pharmaceutical companies. The content of this event is for general education purposes only, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment about your particular condition. Without further ado, Dr. Dani Halpern.
Thank you, Denise. And thank you everyone for joining us today. I'm honored to be here. As Dr. Moses mentioned, I'm an adult hospitalist, as well as a pediatric hospitalist and ED physician in Boston. What this means is that for the past year, COVID has been a very large part of my work life, and I've seen it in all of its different forms, from those who unfortunately get very sick and need to be intubated, to those who experience debilitating cough and shortness of breath or vomiting, those who find out they are positive because they came to the hospital for a different reason, as well as those who may not be positive for COVID, but are suffering from the mental health toll the past year has taken, or have avoided medical care for their other medical issues. This past year has been very tough and sometimes confusing for everyone, with new information coming in constantly and occasionally conflicting prior information as the medical and scientific community learns more. We are now blessed with multiple vaccines that were rapidly developed through unheard of scientific cooperation, funding, and diligence that are safe and effective. We have seen coronaviruses prior to this year. They usually cause mild symptoms and are referred to as one of the common cold viruses. While the vaccines may not fully take COVID-19 away in the same way smallpox has been eradicated, that still remains to be seen. They are near perfect in preventing hospitalization and death and returning coronavirus to just another common cold, even in the unlikely event that you contract it after vaccination. Everyone is eager to return to normal life, and vaccination will help us get there. Specifically, in regards to the mikveh, a precious focal point of Jewish life, COVID has been particularly challenging, given the close proximity there that we have been previously used to. With increasing vaccination and declining cases, we can start returning to use our mikvahot as we had previously, as a reprieve from the chaos of a household, a place to focus on ourselves and our relationships, and devote time to Tahara Mishpacha. Over the course of this event, I plan on addressing mikvah guidelines, some of the concerns regarding potential side effects of the vaccines, as well as reasons why to get vaccinated, even if you are low risk or have already had COVID. These are based on questions submitted ahead of time by registrants, and I hope to address many more topics over the course of the next hour to hour and a half. This whole year has been full of a lot of new, and new can be scary. We don't have all the answers, but I hope to be upfront and discuss openly what answers we do have, which we are fairly confident on, and which we are still learning about with the ongoing studies on millions of people. Thank you for being with us today.
Thank you so much, Dr. Halpern. And now Dr. Alyssa Hellman.
Hi, everyone. Thanks for having me. I am happy to be here this morning and address some of your concerns regarding OBGYN issues that often come up in conversation when a woman is thinking of getting the vaccine. I think we all really need to understand that there's still a lot that we don't know because we haven't yet had the time to learn it. And this is new for everyone, but I'm going to really try to speak on what we do know already. A really important perspective to have is that when we talk about getting the vaccine, the question isn't really, should I get the vaccine or should I not get the vaccine? It's, should I get the vaccine? And if I don't, is the risk of the alternative something that I'm willing to accept? And that's a really important thing to think about, especially with pregnancy. We know that pregnant women have a decreased immune system, which is a normal physiologic change in pregnancy, but it does make pregnancy a high-risk state when we talk about vaccine discussions. Pregnant women with COVID are 5 times more likely to be hospitalized, 3 times more likely to be admitted to the ICU, and almost double the rate of death from COVID-19 infection than in non-pregnant women. So this is a really serious decision. The information that I build my recommendations off of are direct recommendations from ACOG and ASRM and ABM. These are our nation's societies on OBGYN, reproductive medicine, and breastfeeding medicine. And the main recommendations are summarized by COVID vaccines should not be withheld from pregnant women. Vaccination is strongly encouraged for women thinking about conceiving in the near future, and it is not necessary to delay pregnancy for any amount of time after completing the vaccine series. And thirdly, the infertility claims are completely unfounded and disproven. Pregnant women were not included in the original very large studies on the Pfizer and Moderna vaccines, though there were women who found out that they were pregnant in between doses. So far, there have been no reported negative pregnancy outcomes or complications related to the vaccine use that we know of. Because there were no reproductive safety concerns in animal studies, many pregnant women chose to get the vaccine. There's a very large ongoing study of women who opted to get the vaccine during their pregnancies and entered into the CDC VSafe registry. Dr. Halpern is one of them. These women have been delivering and their babies, and preliminary results have shown no significant increased risk in many negative pregnancy outcomes over the normal numbers for these things. They include miscarriage, stillbirth, preterm birth, birth defects, preeclampsia, gestational diabetes, and more. There have also been safety reports to VAERS, and most of them were non-pregnancy related. Those that were pregnancy related were not outside of the normal numbers for those occurrences, like miscarriages. Vaccination in pregnancy is not a new thing. It is standard recommendation during pregnancy to get the flu shot seasonally and Tdap vaccine, which have all been proven to be extremely safe. The way they work is once your body has made antibodies against the virus, those antibodies get passed on to your fetus. The baby is not actually using its own immune system, which is still very immature, to make its own antibodies. This is the same mechanism for transmission of COVID antibodies. Dr. Moses got her vaccine when she was breastfeeding. Dr. Halpern got her vaccine while she was pregnant. And I would encourage you to use that as good examples for people who are practicing medicine and made the educated decision to get their vaccines during those times in their life when there is uncertainty involving vaccines and how they affect an unborn child. And it's very encouraging, all the safety reports that we are currently seeing.
Amazing. Thank you so much, Dr. Hellman. All right, so we'll start with Dr. Halpern. Can you expand some more on Mikvah guidelines and how we should approach Taharat Mishpacha at this time?
Absolutely. So at the start of the pandemic, when we were still learning a lot about COVID-19 and its transmission, many communities, with the help of mikvah.org and other organizations, came together to develop different mikvah guidelines about how to act so that we can continue to use the mikvah but do so safely. Now that more and more people are being vaccinated and we have more data about COVID-19 and its transmission, it may be time to revisit those guidelines if that is correct for your community. And ongoing discussions can be had with the mikvah boards of the various communities. But things that I would start to recommend is things that we know from speaking to women throughout this pandemic is that prepping at home can be very difficult for a lot of women. Not every woman has access to a bath. Not every woman has access to the time necessary to do a full preparation at home when there might be a lot of interruptions. And so I think it's important that we be sensitive to those challenges and that we start to take those into account. With the ongoing studies, we have learned quite a bit in that the risk of transmission from COVID-19 on surfaces is quite low relative to the other ways that it is transmitted, namely droplet as well as direct contact. And with cleaning the surfaces, I believe that we should be able to start using our mikvahs as we originally intended them, as a way for people to come and prepare if they would like, with the option to still prepare at home. The risk of getting COVID from a laundered towel is exceedingly low. And as we have opened up public bathrooms and gyms and all that over the course of the year, the ongoing studies have revealed that the risk of transmission there, provided people are masked and engaging in hand hygiene, is low. I think that we need to continue to be diligent in terms of asking women if they're having any symptoms, and if they are having symptoms, to stay home so as not to risk infecting other people. But without any symptoms, then it should be safe for women to start coming back to the mikvah, preparing there if that is what they would like, and engaging in the full mikvah experience. It is up to each individual community about whether they feel like they would be able to support that and whether the mikvah attendants are comfortable with that. As vaccine rates increase, then you may have a situation where both the mikvah attendant and the women attending the mikvah are both vaccinated. And according to the CDC guidelines, they, in theory, don't even need to wear a mask, but it may be difficult to have such a differentiated policy. So I would continue to encourage full masking while there's a direct contact and then the mikvah attendant stepping back. but I think we can start to be much more lenient in terms of the preparing at the mikveh, which will make the mikveh experience a lot easier for many women.
That was very informative. Thank you so much. Okay, so I will start with the Q&A portion of the event. So I'd like to start off first for Dr. Halpern. Are the vaccines FDA approved? And what is the difference between FDA approval and emergency use authorization?
That's a great question. So the vaccines are currently in the state of emergency use authorization, with the exception of Johnson & Johnson, which in the past week there has been put on pause while they investigate some concerns in regards to blood clots that some of you may have heard of. What the difference between emergency use authorization and full FDA approval is in regards to the in regards to what extent the vaccines have demonstrated safe and effectiveness. However, with these emergency use authorizations, because it was in the middle of a pandemic, all the vaccines that were developed for this purpose have already been tested with open results available on, at this point, hundreds of thousands, and now we're approaching millions of people. And because we take the safety of vaccines so strictly in this country, we have such a high bar for vaccines. And so in order to call them fully FDA approved, in which they can be given privately, then they need to demonstrate on multiple fronts for a very long period of time. Because of the dangers of the pandemic, the FDA did not want to wait for the full approval, and they granted this emergency use authorization, similar to that they did to the medication that we use in the hospital, remdesivir. And we now have the studies that back up the efficacy and the safety of these vaccines. And Moderna just announced that they are going to be applying for full FDA approval within the next 2 weeks. And I suspect Pfizer will be doing the same. So while they might be still considered under emergency use authorization, we have much more data on them in terms of their efficacy and their safety than we do for many of the medications that come to market under full FDA approval, because they have already been used in so many people.
Thank you. Okay. All right, so I'll go to Dr. Hellman. Has anyone gotten pregnant after the COVID vaccine? And is it safe to get the COVID vaccine during pregnancy or trying to get pregnant?
Yeah, so definitely people have gotten pregnant, both soon after they've gotten the vaccine, in between their COVID vaccine series, and after it was completely done. And we are following all of those people in these ongoing studies, and we have not seen any negative outcome from any negative obstetric outcome that we know of from the vaccines. The ACOG recommendations, as I alluded to in my intro, really strongly recommend that anyone in this phase of life trying to get pregnant, currently pregnant. No, and it actually also does not differentiate between trimesters. So first trimester, second trimester, third trimester, they don't specify that one trimester would be less okay than others for vaccination. Really do strongly say that if you want the vaccine and you are pregnant, you're planning on getting pregnant, it should be available to you.
I just want to announce if there's any issues with the live stream, please email vaxfacts@joma.org and they will help adjust that for you. Okay. So, Dr. Hellman, another question that we have been getting a lot and that has been coming up a lot. Does the vaccine cause infertility?
Right, so this is the $1 million question, which I can answer um, very, what's the word? like for sure. So where did all this come from? That this vaccine causes infertility? It came from a random blog on the internet based in no type of science whatsoever. Someone who really did not have a background made a connection that is just has no scientific basis. So one of the proteins involved in the placenta has a similar name to, or a similar structure to, the spike protein that the COVID antibody is against, and that's how it recognizes the COVID vaccine. Just similar name, similar structure. That doesn't mean that the antibody against the COVID protein will also attack the antibody, the protein on the placenta. It just doesn't happen. But I think because someone who wasn't informed made a connection based on the name of the protein, really blew up this fear that just exploded all over the internet, all over social media. And anyone who has that fear is going to see that, and it's going to get into their psyche, and they're going to have concerns over it. So there, in all of the animal studies done, which was even before the EUA was granted by the FDA, there, in all the animal models, there were no fertility issues of these animals getting pregnant, and no negative pregnancy effects like miscarriage or preterm delivery from the vaccine itself. So I can very strongly say that this vaccine does not cause infertility. Also, infertility is something that is ongoing, right? You don't have infertility for 1 month. It's a diagnosis that is made for many, with many reasons after many tests. And we think that any potential effect on someone's cycle, which I will get into later, is transient, right? So there shouldn't even be even establishing that the vaccine does not cause infertility. If it has a little transient effect, it's over within a month or two. So there should be no long-term effect on infertility.
Thank you so much. All right, Dr. Halpern, do you recommend one of the vaccines over the others, and why or why not?
So that's a great question. And all of the vaccines have been shown to be effective in our ultimate goal, which is preventing hospitalizations and preventing death. They've all shown to be greater than 90% effective, which is much more effective than many of the vaccines that we accept on a regular basis. The number that you might hear in terms of efficacy reported in the news, that Johnson & Johnson is 70% effective, and Pfizer and Moderna are anywhere from 92 to 95% effective. This is in regards to whether people have then develop the infection or develop symptoms from it. But in terms of our ultimate goal, they've all been uniformly effective in keeping people out of the hospital. Johnson & Johnson, we will see what happens with it later this week in terms of the blood clots. Right now, the distribution of it is on pause, but I would not go ahead and recommend one versus the other. I would recommend whichever one is available to you. I'm part of a mixed marriage. I received Pfizer. My husband received Johnson & Johnson. That's what was available to us at the time. And my husband actually received the Johnson & Johnson vaccine the day before the FDA came out with their announcement. And I know we'll touch more about the concerns regarding Johnson & Johnson in a little bit, but I would not change my recommendation to go with one of the other vaccines over the Johnson & Johnson based on the data that has come out. Cases have been plummeting. Israel, which has used the Pfizer vaccine and has now vaccinated remarkably almost 80% of their population. Cases there have plummeted, and they've recently published a study that shows that among the vaccinated people, they have not had nearly any hospitalizations, and they have or deaths. So these are really effective in terms of what we're trying to prevent. Johnson & Johnson was studied while the variants were circulating. Pfizer and Moderna, those were studied over the summer before those variants were circulating. And so they're ongoing studies to demonstrate how effective they are against these variants. But all the studies have been showing very, very promising results.
Excellent. So it's looking like if someone had the vaccine and then gets exposed to a variant, there's a possibility that they will not actually get COVID from the new variant. Is that correct?
Correct. And there's a slight differences among the different variants, and these studies, as we said, are ongoing. There was a study that thought that perhaps the South African variant, which is one that's less prevalent here in the United States, might be a little more effective in infecting, but still not effective in terms of getting you sick to the point of needing hospitalization. But in terms of the B.1.1.7 variant, which is the one that's dominant here in the United States, all the ongoing studies have shown very good results in terms of preventing infection, preventing sickness, preventing hospitalization.
That's very promising. All right, Dr. Hellman, some women have said that the vaccine has affected their period, that they've had bleeding or stopped bleeding shortly after receiving one or both of the shots, depending on if it was Pfizer or Moderna, and even with the Johnson & Johnson single dose. Can you expand on what is going on in terms of issues with irregular bleeding after getting the vaccine?
Yeah, so this is all sometimes a little hard to talk about scientifically because when they were doing the studies on the vaccine and they're having people list all of their potential side effects from it, menstrual irregularities were not included in that. So that is why now, once the vaccines have been rolled out and we are seeing people get them, there's all these kind of anecdotal reports of, hey, my period was a little weird, it was longer, it was heavier, it was more painful, it was pushed off. And we're not totally sure because that was not something that was followed in the larger vaccine side effect evaluation. So right now, all I can say is we're not sure. We don't know, but it seems that enough people, enough women have come forward with these concerns or with these observations that we do think there is maybe something to it. There actually is out of Illinois currently a study that has just started to look at this specifically. And there have been a lot of experts in the field in OBGYN, in inflammatory, processes of like, hey, what's a mechanism for why this may be happening? And there's kind of a few different ways to think about it. One is it's a total coincidence. Who knows? Maybe there is, maybe there isn't, because not every single person gets this response. Number two, we know very well that in times of stress and in sickness, periods change, right? It's kind of like another vital sign, right? Just like your blood pressure, your heart rate, your temperature. Periods can do weird things when your body's in a time of stress, emotional stress and physical stress. So are you so nervous about the vaccine? Are you so nervous about COVID? Are you worried about a family member who is also sick? Can that affect that period? And are you super nervous about figuring out what to do for yourself with the vaccine? That can also kind of add some physical and emotional stress that makes that period a little bit, around that time makes it a little bit different, longer, shorter, heavier, crampier. But when we are, so those are things that kind of outside of the, I guess, scientific reasoning. One theory that does kind of make some sense is that the uterine lining, which has that tissue that you bleed out, and that's what your period is very affected by your immune system. So there can be an immune reaction in it that could cause it to all of a sudden react, like once your body's already going through an immune response, where you get your vaccine and your body is now busy creating all those good antibodies and having the response, and your uterine lining is kind of part of that immune system, right? It actually is very protective against things going inside the vagina and inside the uterus every month normally. So is it reacting to the vaccine? Possibly. I don't think we really know yet, if it for sure is, but I can tell you that it's very much related to when you get the vaccine. And because there's 2 doses, it may seem like it's happening 2 months in a row, right? Because they're 3 to 4 weeks apart, which is kind of like what your period does. So can you have 2 weird periods? Definitely. Is it something that will continue for months and months and months and like change your period completely? We do not think so. We think it is a very transient effect on your period, if there even is one, related specifically to when you got that specific dose. And that obviously, being, Kallah teachers or doulas or people in women's health, you're going to get these questions. Oh, especially at Kallah, my period, I thought it was this time, it was, and it came early and I just got the vaccine. Like, did I mess something up? And, that can definitely be stressful that month for someone to deal with. But, really the reassurance comes in, it's probably just transient. It's probably just this month. And I don't know if we're going to ask this later, but something to think about is if it's really important for a woman to only have her period at a certain time because of like planning a wedding or something like that, you may want to think about, should I get the vaccine this month? Should I get it earlier? Should I get it later? Because maybe it does affect that specific period. It may not, but it could. So that's just another thing to have in your back of your mind when you're thinking about the timing of your vaccination.
Great, thank you. I think that's really helpful. And along that vein, do you want to talk about timing of when to get the vaccine in terms of if someone's single, if someone's planning on getting married, if someone's planning on getting pregnant, etc.?
Yeah, so if you are not planning a pregnancy soon, get your vaccine. If you are planning a pregnancy soon, get your vaccine. If you are pregnant, you can also get your vaccine. So I think, there's a couple of hesitations. I guess a broad recommendation would be, if you can get it, get it. You will only have a stronger immune system against COVID, which can cause, more serious complications with a future pregnancy if you were to get infected then. So the thought, but there's really only 2 scenarios where I can see thinking about delaying it. One would be, like I kind of just mentioned, if you literally like are getting married soon, you don't want to have your period around your wedding, and there's a possibility that your period could come a little bit early if you got your vaccine, maybe like get it a couple weeks before or a couple weeks after. And 2, some people will feel a little bit hesitant when pregnant to get it in their first trimester. The reason for that is potentially there could be a high fever from it, and we don't know if that's going to affect the embryo or not. There have been absolutely no recommendations to not get it in the first trimester. So when ACOG recommends getting it for pregnancy because of the risk a pregnant woman has of getting severe COVID illness, they don't say, oh, but don't get it in the first trimester. And I think we really need to internalize that and understand that, yes, everyone's a little bit nervous when they're first pregnant, because that's when the embryo itself is forming. But we know that the vaccine itself is not getting into the uterus. It's not getting into the baby. The antibodies are what gets transferred. Your antibodies that you already make, your antibodies for any infection that you already make, that's what's going into your baby. So, I think there's a lot of, because there's still a lot of unknown, there's a lot of fear, and people just kind of assume that when they're in this kind of nervous first trimester time, are they going to have a miscarriage or not? And that's a normal nervous response for any pregnant woman. And then you add the vaccine in there. I think you just have to kind of take a step back and see, this has been studied in thousands of women, thousands of pregnancies, and we have not seen any negative pregnancy outcomes, especially in the first trimester. And I would feel safe, and I do this on a daily basis. I recommend to my patients, regardless of where you are in your pregnancy, if you want to get the vaccine, I support that decision. And right now I have nothing to tell you that it's unsafe.
Thank you so much for that clarification. Dr. Halpern, what are some of the side effects that people can expect when they get the vaccine? And we talked about, some possibilities for women, but what are some side effects that also both men and women can expect?
Yeah, so thank you, Dr. Hellman, for focusing on the obstetric gynecologic side effects. I'm going to take a more broad view of side effects. And when we think of side effects, we divide them into multiple categories. We have what we call localized symptoms, and those you can think of as somebody poked me in the arm and it hurts and it might be painful and it's red and maybe a little swollen there. Things surrounding the actual muscle that received the shot. Then we have what's called systemic side effects. And those are ones that you may have heard of from friends or family members who have received some of the vaccines, who within the first day or two did not feel themselves. They maybe had a fever, maybe had some chills, maybe had some body aches. This was not them coming down with the illness. This was their body producing an immune response to the vaccine. And when the body produces an immune response to the vaccine, fever, chills, body aches are things that go along with it. We get those things from illnesses because that's our body's way of mounting an immune response. People who are immunosuppressed often don't have those reactions to things, but we develop them in response to a vaccine because that's our body's way of mounting an immune response, developing antibodies. And while it's not fun having those symptoms, it can show you that the vaccine is working. If you don't get those side effects, it doesn't mean the vaccine is not working. It just might mean that you lucked out a little bit and you don't have the day of feeling a little bit miserable. And then there's other side effects that a lot of people have been concerned about in regards to a new vaccine, which is, what about the long term? And what does this mean for possible long-term side effects? Are there any? How do we know if they've only been in development for under a year? And the answer is that, can we say with 100% certainty that there are zero long-term side effects? No, because we can only say based on what we have studied, and we've only been studying them for under a year now. But we can say that based on all the studies that have been done, and these are studies that have been done on now hundreds of thousands of people, that there have not been any signals. And by signals, I mean anything above baseline that people have developed. And more importantly, is based on how the vaccines work, we do not really think that there's a biologically plausible explanation for how it can develop things like autoimmune diseases and other things that people have been concerned about developing in the long term. Because these vaccines, the mRNA does not enter your DNA. The DNA is closed off in the nucleus. The mRNA comes into the cell and uses your body's own machinery, which are called ribosomes, to make proteins. It does not interact with your DNA at all, so it does not have any way of getting into your DNA and causing problems down the line. And same with the other type of vaccine, the what you might have heard of as the vector adenovirus vaccine, Johnson & Johnson and AstraZeneca in Europe. Those do not interact with your DNA at all. Again, it's the protein coming into your body and your body reacting to that protein and developing your own antibodies. So it does not make sense from what we know biologically that this would cause downstream long-term side effects because there is no interaction with your DNA. And that was what would be necessary in order to cause that.
So it doesn't alter our DNA.
Does not.
Just going to put that out there.
No way for that to happen.
Okay. It won't genetically modify us.
No, it cannot genetically modify us. It is partitioned off. DNA in the nucleus, mRNA outside the nucleus, and, but inside the cell, using your cell's machinery to make proteins.
All right. We have that very clear. Another question I'd like to ask you, Dr. Halpern. This is a question that comes up very often. A person already had COVID. Why should they get the vaccine?
And that's a really great question. And for those of you who have had COVID and are doing well now, I'm really glad to hear that. That's wonderful. It must have been a very challenging experience for you and your family. And it's normal to ask, why would I want to interact with this virus any more than I need to? But the truth of the matter is that we don't know how long immunity lasts from a COVID infection, what we call natural immunity, where you come across a virus and you're in a natural way and your body responds by making antibodies. We know that natural immunity confers some benefit, and we've seen anywhere from at least 3 to 6 months. People have been shown to have antibodies against the coronavirus. However, we don't know how long those will last. And we do know that in a lot of other infections, that what we call acquired immunity from vaccines can actually in some ways confer more of a protective benefit than natural immunity. Some viruses, once you've had it and have had an infection with the actual virus, things like chickenpox and polio, we know that you are immune for life and you will not get this infection again. However, in a lot of other viruses, that's not the case. For example, cold viruses, just because you had a cold when you were 4, you will most likely get a cold again, and potentially even with the same virus, the same strain later on in your life, because these viruses act differently and are changing. And based on how other coronaviruses work, we expect that this coronavirus will act more similarly to other cold viruses. We don't know how long the natural immunity will last. It's an ongoing area of research. But when we have an opportunity to boost our immunity with very little risk to ourselves, the risk-benefit analysis in my mind seems to favor getting the vaccine and boosting our immunity for as long as possible. It's possible we may need booster shots going down the line, and that's also an ongoing area of research that hopefully more studies will make clear. But in the meantime, this way we know that we're protected, that we don't have any gaps in our immunity, and we can continue to have high levels of immunity to protect our loved ones, our community, and return to so normal life.
Thank you. Dr. Hellman, a question that comes up very often. I'm breastfeeding my baby. Should I get the vaccine and why?
Yeah, so I think this is a great kind of next question after Dr. Halpern's talk about the vaccine itself boosting immunity, even if you've had COVID itself, and may kind of translate into your decision of should I get vaccinated in pregnancy. So we know that immunity that it forms during vaccination pregnancy gets transferred to the fetus. We know that there are antibodies in breast milk. What we don't know, because it has just started being studied in pregnant women, right? Like maybe just the past 4 to 5 months, really. We don't know what level of antibodies is needed to confer good immunity to a baby. We also don't know if the antibodies in the breast milk are effective at giving the baby immunity, right? Is the baby just swallowing them and that they get digested and chewed up and it's like they didn't get anything? Because that is a possibility, that is another reason why it is recommended to get the vaccine during pregnancy if you're thinking about it, rather than waiting till when you're delivered and breastfeeding, because we think the immunity transferred when your baby is growing in you is bigger than possibly just by breast milk. So the answer to that is we don't really know for sure about the benefits of breast milk in this specific case of transferring immunity. Definitely an area of ongoing study for sure, but we can't say 100% for sure.
Another question about breast. Should women get their mammograms if they got the COVID vaccine? There has been some new information about that.
Yeah, so this also recently kind of came out as, aside from the period thing, like, hey, well, how does it affect mammograms? And when you get the COVID vaccine, one of the main side effects, like Dr. Halpern said, is just kind of like feeling sick. You can get enlarged lymph nodes in the armpit area and the neck area. So especially the armpit area, those are very close to breast tissue, and those may show up as enlarged lymph nodes on a mammogram, which outside of an infection can be potentially concerning if we're worried about, we're screening for breast cancer. And right now there's a thought that you should try to separate your screening mammogram by your COVID vaccines about 6 weeks, because that may be the amount of time it takes for your reactive lymph nodes, which are good and normal. And that means that your body is doing what it's supposed to do to build those antibodies, right? Your lymph nodes are the center of your white blood cells and your immune system kind of producing antibodies. So that's a good response, the enlargement. But to avoid any potential imaging concerns on mammogram, we should try to maybe separate them a little bit. If, however, there is a concern for like a breast lump and you're getting breast imaging because there's a real breast concern that you found or your doctor found, and it is within that 6-week time frame of when you have had your last vaccine or you're in the middle of your vaccine series, don't delay that, right? Like we would never say delay a potential, concerning diagnosis of your breast tissue just because you got the vaccine. But if we're talking about screening mammograms, I would probably recommend to delay your screening mammogram if there are no actual breast concerns by about 6 weeks, just to avoid any potential like imaging findings of enlarged lymph nodes that may be confused. Is it this a vaccine reaction or is it an actual breast concern?
Amazing. Thank you so much. This was also addressed in our Women's Health Committee webinar on cancer screening and prevention by Dr. Gams regarding mammograms after the COVID vaccine. Okay, Dr. Halpern, the next question I have for you is, can the COVID vaccine give you COVID?
100% no. That as you've seen during this telecast so far, there are some questions where we can't say with 100% certainty the answer. This one, I can tell you definitively, it cannot give you COVID. In both types of vaccines, so in the mRNA vaccine, as we have talked about, you are only getting the mRNA, which is you can think of it as a blueprint for the body. It is just like you need a blueprint to build a house, your body needs blueprints to build proteins. And so what the vaccine does is it gives you a small snippet of the blueprint to build the spike protein, the protein that then goes ahead and infects our cells. Now, this is not the full virus. We cannot build the full virus from this vaccine. We can only build the part of the virus with our own cell machinery to build that spike protein that our body then goes ahead and recognizes and produces antibodies against. And in the same way, the Johnson & Johnson vaccine, which introduces the spike protein into our body via a different denatured virus, then that goes and again presents it on our cells to the body, so that the body sees that, says that shouldn't be there, and goes ahead and produces antibodies to it. This is just a mechanism of tricking our body into producing antibodies, but it cannot in any way give you a COVID infection. And the way we know that is because of the hundreds of thousands of people who have been studied, the only ones to have ever required hospitalization from the after receiving their vaccine are ones who unfortunately did not mount sufficient immune response or were infected with COVID after receiving the vaccine within the time frame of their first and second shot. And they are the only ones to have developed a severe infection, whereas everyone else, if at most had a day of fever, which, as we talked about, is your body's immune response.
Along the same vein, Dr. Halpern, is the timing between the first and second dose important? Can someone get the first dose and then 6 months later get the second dose? And what's the efficacy of the vaccine's first dose against COVID-19 as opposed to the efficacy of having 2 doses?
So Pfizer and Moderna, which each require 2 doses, Pfizer needing 3 weeks, Moderna needing 4 weeks. Those are the timeframes that were tested during the clinical trials. Why they chose 3 weeks and 4 weeks, that's up to the developers of the vaccine. And it's possible that that timeframe can be lengthened, but it's not what was studied. So all the data is based on getting the 2 shots at these particular timeframes. And that is what's being recommended because we'd rather go based on what we know than based on what we don't know. However, in countries where they've had more difficulty in obtaining vaccines, they are lengthening the period between vaccines. And so far, their results have been encouraging. However, here, where thank God we have a sufficient supply of vaccines, I would continue to encourage people to get them at the recommended timeframe because that's what we have data on. And this way we know that you are mounting as good an immune response as possible. After the first vaccine, the efficacy, and we talked about efficacy earlier, but how much you decrease your likelihood of having a coronavirus infection is reported to be somewhere around 65% for both of the vaccines. That goes up to 95% for the Pfizer and Moderna after you get both 2 weeks after you get both of the shots. So 1 is good, 2 is better for those vaccines. For the Johnson & Johnson vaccine, that is a vaccine which only 1 dose is required as of now and has shown pretty dramatic efficacy with just the 1 dose. And that is really important because it can be very difficult to logistically administer 2 doses to all the people in the United States and around the world. So it's really important that a vaccine like that exists. It's possible that with all these shots, we might need booster shots down the line. And that's an ongoing area of research to which we don't have answers yet, but we will be continuing to study that and discuss with the public.
Great, thank you. Couple of questions for you as well, kind of tied in together. A person is young, healthy, no medical problems. Why should they get the vaccine if their likelihood from recovering from COVID is, as people say, pretty high? And I'll ask the second part after you answer this part.
So it's a great question. The first thing I will say to that is, and I can speak on with firsthand experience, while the likelihood is high for recovering, I have unfortunately seen many young people who, without medical problems this year, who did require hospitalization. A lot of them I did have to transfer to the intensive care unit. So while it might be high, it's not guaranteed. And given the low risk of the vaccines, I would favor encouraging anyone who qualifies, despite what their initial thought of their risk might be, to get it. The other thing is that the people we surround ourselves with are not necessarily low risk, and the vaccines, while they are very effective, are not 100% effective in preventing an infection. No vaccine is. And so we do many things to protect the people in our lives. And this is another one that I would recommend to protect the people in your life. Going back to kind of some of the obstetric things that we say, we said that we get a Tdap vaccine in pregnancy to prevent against pertussis. Pertussis is an infection that really does not have many effects on adults, but can be devastating for babies. And so this is not the first time that we get a vaccine to help protect against others. Everyone gets a rubella vaccine to help protect any pregnant women who may not be immune. And so you can think of the coronavirus vaccine, even if you consider yourself low risk, as another thing you do for the good of the people in your life. And also protecting yourself, because you don't know what might happen to you if you get the infection.
All right, thank you. I would also like to ask, some people have discussed taking vitamins, taking, I don't know, ivermectin, these other type of protocols before, getting a vaccine to actively protect against getting the virus. Is there any research on efficacy of these protocols versus research on the vaccine?
So I don't think that there have been any direct head-to-head trials between any of these other protocols and the vaccine. The studies that I have read and seen about a lot of these protocols in regards to vitamins and ivermectin have shown that they do not protect against a coronavirus infection, and that there's not much data to support their use. Ivermectin is a medication we use in the hospital to help with parasitic infections. Coronavirus is not a parasite. And so there is not really much data to support its use. And while I won't necessarily tell anyone that they should not take a particular vitamin, as long as it's okay with their doctor, I also would not rely upon it to protect it yourself against any particular infection.
Thank you for clearing that up. All right, Dr. Halpern, another question for you.
Please.
I got the vaccine. Can I stop wearing a mask? Can I go back to normal?
The $1,000,000 question. When can we achieve normalcy? And the CDC has started making some recommendations in that regard. As far as if you are having a small group gathering in which everyone there is vaccinated, then you don't need to be masked. Another point for getting the vaccine. If you're meeting with if the people from your household, as well as another household that is unvaccinated, one other household, then that's okay, because we presume that your immunity you will not go ahead and infect them, and they will not go ahead and infect you. Where things become more complicated still at this point, when we are still seeing a not insignificant number of cases out in the community, is when we are talking about larger group gatherings. And with those, we would still recommend that people continue to be masked, even if they have been vaccinated, because we don't know, as we said, vaccines are not 100% effective. It also requires 2 weeks after the last dose of the vaccine before we think that your antibody level is at full strength. And so we want to make sure that everyone is protected. And the more people you get together in a room, the likelihood increases that they have not all been vaccinated. B, the likelihood increases that one of them may have coronavirus or an undetected case of coronavirus, because we still have quite a number of circulating cases. I admitted at least 5 people last week to the hospital with coronavirus of all ages. And so we would still continue to recommend in larger gatherings to go unmasked, but for private gatherings, especially ones in which that everyone has been vaccinated, then you can go ahead and take a breather, take a mask break.
That sounds amazing. Dr. Hellman, going back to vaccines and pregnancy, is there any sort of timing between getting the COVID vaccine in pregnancy and when we should get the other recommended vaccines during pregnancy?
Yeah, and that's a great question. It is standard to get the Tdap vaccine, which protects your baby against pertussis, which causes the whooping cough, which is another respiratory illness that can really affect a baby very negatively. And that's typically given between, the recommended time frame is between 27 and like 36, 37 weeks. Generally, the better you mount a better immune response to that, the earlier in that time frame you get it. But with the COVID vaccine this year, right, because this is the first year we've had to deal with it, is to separate the COVID vaccine, either one of them, and the Tdap vaccine by 2 weeks. So if you are in the middle of your COVID series and you're getting it, in that kind of time frame around 27, 28, 30 weeks when we normally give it, we would delay the Tdap, because there is a pretty big time frame that we can give it. And this year, right now, COVID is probably more of a risk than pertussis. And we can still get that pertussis one in. So it's just something to think about if you are planning on getting during pregnancy. If you want to stay on the recommended schedule for the Tdap, you can either make sure that your COVID series is done by about like 25, 26 weeks, or you start the COVID series 2 weeks after your Tdap vaccine, just to kind of separate allow your body to build a full good immune response to both of the things we're trying to get it to do, instead of just having too much to do and doing neither one as efficiently as it could. So just something to think about.
Story of motherhood.
Yeah. What?
Story of motherhood.
Exactly, right? It's good preparation.
Exactly. All right, Dr. Halpern, can you discuss the Johnson & Johnson cerebral venous sinus thrombosis issue?
Absolutely. So, as many of you probably already know, the FDA has started doing increased investigation of the Johnson & Johnson vaccine after reports of 6 women who developed clotting, as well as low platelets in the 4 to 2 week range after receiving the Johnson & Johnson vaccine. They still do not know whether this is related to the Johnson & Johnson vaccine, and this is something that is they're looking at the cases of each of those women, and then they are going to be making their recommendations in about 5 days. They're supposed to meet on April 23rd to determine whether the Johnson & Johnson vaccine should continue to be distributed. Now, to put things in perspective, millions, and I believe the number was up to 7 million before the vaccine was pulled temporarily, of people have received the Johnson & Johnson vaccine. And we are talking about 6 women. And it is unfortunate for those women. However, that means that 7 million minus 6 did not develop these clots. And these are very rare, but it's also something that we see outside of the world of vaccination. And so it's hard to know, are they related to the vaccine, or are they something that these women may have developed even without the vaccine? We do know that some of these women were on oral contraceptive pills, which can increase your likelihood of a clot. And we do know that what these women were trying to do was prevent COVID vaccine, which we know extremely increases your risk of a clot. And many patients who develop an infection with COVID, far more than the 1 in a million that have developed clotting after the Johnson & Johnson vaccine, have developed blood clots, leg clots, many different types of clots, and now require anticoagulation. So I am very interested to see what the results of the FDA investigation shows later this week. As I said earlier, my husband received the Johnson & Johnson vaccine the day prior to the announcement. I do not regret him receiving that. I still have full confidence in the studies that led to this vaccine acquiring emergency use authorization. And I'm also encouraged by the response of the FDA, because it shows how seriously we take vaccine safety, in that we are willing to put a program on pause for vaccination when only less than 1 in a million people have developed some complication, that we take the potential for side effects so seriously, and they are looking at the data so closely that A, they were able to detect a signal, and B, that they wanted to get to the bottom of it. And to me, while some might find that scary, I've actually found that encouraging, that we take the safety of these vaccines so seriously.
Thank you so much for clarifying the importance of being followed as well for any side effects. We also encourage everyone that gets the vaccine to sign up for VSafe through the CDC, so that any other side effects can be monitored, looked out for, etc. Dr. Hellman, is there anything else that you would like to add regarding this entire conversation? Anything you want people to know?
Yeah, I'm just going to go back, no specific information, but I'm just going to go back to what I mentioned in the beginning is that, pregnancy is a high risk state. And you are at risk for getting much sicker, especially with a respiratory virus. And you have a person inside of you too, who can also be sick with you. And, when you're making the vaccine decision that feels right for you based on what you've heard, based on what you've read, based on kind of understanding the science behind it is know that you're making that decision. Should I get it? Should I not get it? And the decision is, or what will happen, right? Or is my risk of getting COVID still high? Is my risk of being really sick from COVID still high? What is my risk of getting the infection to begin with? And comparing that risk to getting a vaccine. So it's not just an isolated vaccine decision in and of itself. It potentially could have real consequences if you were to get very sick from an actual infection, and to just kind of keep that in mind. And that still may not change your decision, or it really may help your decision, but just don't forget to think about that point.
Thank you. And Dr. Halpern, anything else you would like to add?
I completely agree with what Dr. Hellman was saying in terms of being thoughtful about the types of risks that you're weighing, that it's not vaccine or no vaccine, but the risks of getting COVID versus, and agreed, you may not get coronavirus, but the risks of potentially getting coronavirus versus the risk of the vaccine. And then also being really thoughtful about where you're getting your information from and making sure that it's a source that you can trust, and being honest with yourself about why you trust that source and what experience whatever source that may be has in regards to coronavirus and vaccines, and just making sure that you're getting a complete picture, because there's a lot of information out there, and some of it has been studied and some of it is based on fears, and fear is a very powerful thing, but unfortunately does not necessarily give us all the tools we need to make informed decisions. And so with that, I empower all of you to make an informed decision that is right for you and right for your family. And we are always here at JOMA to answer whatever questions that you may have.
Yes. And, as we continue to learn more about the virus, we will continue to update and continue to have town halls and meetings, and continue to empower and educate everyone in terms of what the correct information is. Our goal is to provide the best, most current information possible using reputable sources. So a couple of those, if people want to check on it themselves, are acog.org, which is the American College of OBGYN, ASRM, which is the American Society of Reproductive Medicine, and the American Academy of Breastfeeding Medicine. Any other sources that you would like to recommend our listeners to check out?
So just from the non-pregnancy and GYN perspective, the CDC has a very user-friendly website, as does the American College of Physicians, which is the internal medicine organization in America, that can all present what we know, what we don't know, what we're still studying, and answers to a lot of the questions that we discussed here in greater detail.
Thank you. It's really such a gift to be living in a time like this, where we can have a vaccine that's created so quickly and can be so protective. I'm going to share my screen, so just bear with me. So I would like to thank everyone on behalf of JOMA for attending. I would like to thank our panelists, Dr. Alyssa Hellman, Dr. Danny Halpern, for addressing so many of these common concerns that people are having. I would also like to show these resources discussing the COVID vaccines. This is a brochure. It does say draft on it, but it's actually the final version. So ignore that part. And then you can also go to joma.org/COVID-19 or email vaxfacts@joma.org. So this is a brochure that we'll be providing. Feel free to take screenshots of this so that you can get some more information. And this is another flyer about also common questions that people have about the COVID vaccine. Please email vaxfacts@joma.org to request these materials. We were not paid to do this town hall. We do not get paid to promote vaccines. We also would like you guys to take a look at these brochures and materials. And if we do not have time to answer your questions, please follow us on Instagram at joma.org or go to joma.org/COVID-19. There's also a survey that we recommend everyone fill out, and there's a chance to win a $100 Amazon gift card. This Tuesday night at 9 p.m. is our town hall for our healthcare professionals. Okay. We would like to extend our heartfelt gratitude to our partners and our volunteers who work tirelessly to make this happen. Thank you for taking the time out of your schedule to learn about COVID-19, learn about the vaccines, and this way you can feel confident giving information that's up to date to the women that you interact with. Enjoy the rest of your day.